Maya Chavez.
Hi, thank you for giving me a moment to speak. I want to say also thank you to Dr. Goldberg. It is nice to see some of the medical professionals turning out to make their voices heard in this discussion. I want to start by discussing some concerns I have with the current public health guidance for Providence. But I want to begin by saying that I'm not here to call Providence out. I'm here to call Providence in. But I am going to call you out for being on the phone right now. As a civics teacher, I'm going to go ahead and ask that you give your full attention to the public comment that is being offered to you, sir, if you have your speaker on. Thank you.
The wonderful thing about my ability is I can multitask. So thank you and continue with your comments.
It's interesting because that's not our policy in Providence Public Schools. So my 6 concerns are,
The wonderful thing about being an adult. Go ahead with your comments.
The very first principle in my classroom is that all people have an equal right to be respected, and I would like you to honor that as well. So number one, my concern is that
it's a two-way street, ma'am. It's a two-way street.
This is
So you
public
can waste your
commentary.
time arguing with me and attacking me. You can make your comments.
If you interrupt public commentary, you're in violation of the Open Meetings Act. My first concern is masks will be recommended. I will, thank you. Masks will be recommended but not required in classrooms. Secondly, high schoolers will not be in stable groups, nor will they be able to maintain a distance of 6 feet outside of those stable groups. Stable groups for elementary school students are not being done with fidelity, as specialist teachers will move between groups. There is currently in the public health guidance for Providence no plan for testing. The plan relies entirely on the self-reporting of symptoms, despite the fact that we understand this is a disease that is asymptomatic in 40% of cases. An additional concern, students who arrive at the bus stop in the morning and are showing symptoms will be put on the bus anyway if there is no parent or guardian to take them home. The plan is also based on unrealistic assumptions. For example, if a teacher is sick with COVID, that teacher's class will be moved to, and I'm quoting, a space in the building that is not frequently used, such as a cafeteria or gymnasium. I'm curious what schools are not really using their cafeterias or their gymnasiums. I say all of this because this plan is egregious. The mere fact we've been told we're going to return to a dangerous situation is inflicting trauma on our community. But like I said, I'm not here to call you out. I'm here to call you in. The districts in Rhode Island that face the highest rates of COVID-19 are also the districts that are struggling the most. We cannot be left on our own to try and manage this crisis as a district. We need to ask the state, we need to ask Governor Raimondo to step up and provide additional resources to our community. I was very much comforted by the fact that she's looking at public health data at the municipal level today, but we also, in addition to considering the disparate risks our communities face, we need to consider their disparate needs. So for instance, according to the Economic Policy Institute, less than 1 in 5 Black workers and roughly 1 in 6 Hispanic workers are able to work from home. This puts our families in a crisis situation where they need to choose between leaving a child at home potentially with inadequate supervision and no one to support distance learning and having an income. This is unacceptable for the people of Providence, for the urban core of Rhode Island. We cannot handle this on our own. We need to stand in solidarity with other districts in demanding that the state of Rhode Island provide us with the necessary resources. Thank you for your time.
Thank you. All right. I believe that concludes our list of public comment. I don't know if Ms. Sterling was able to join us or not. I don't see her on the meeting participant list, and so we will move to the next item on the agenda.